Okay, so this is, I think I got a little opening here. There we go. It should come right off. You doing okay?
Yeah.
Everybody, it's Dr. Nicole Freels here. I want to share this case with you because number one, I'm super concerned about one of these toes you're getting ready to see. He was very smart. He jumped on WebMD and realized that he should not debride or puncture or anything what you're about to see. Additionally, he's got this big old ram's horn nail that's pressing on it. He's really bruised. There's nothing underlying, and he doesn't really have much feeling, so he didn't know he bumped it actually. So come with me. We're gonna trim some toenails and check out this really black red toe. Come on. That's fully up, perfect. I'm gonna have you turn your foot just a little bit here. Great. And you let me know that the bruising is really interesting, and you know don't have neuropathy. You said that you know of.
Not that I know of.
Well, we'll definitely test for that because typically you do have neuropathy if you know. It really looks like you bumped yourself. It could be just a little cabinet in the kitchen, you know, not even realize it.
Yeah.
I bet you have a hard time getting down here,
Yes,
trimming these nails. Yeah.
Some are easy and some of them aren't.
What's that?
Some of them are easy to trim and some of them aren't.
Yeah, well, when they get thick like this, so you've been using the Pinlac for, did you say a year?
I said what?
You said you've been using the cycloperinox for the Pin. Okay.
A long time.
So we were talking about how that is only 16% effective. That is an antifungal, which is great. You need an antifungal. However, where your nails are so thick, you need urea. Urea is really going to help thin the nail.
That's this stuff.
That's an antifungal. It's to the right, the small bottle, the repair. Okay. Yeah, so the soak is going to be, the relax is going to be the antifungal soak to make them nice and soft. So that's why we soaked them ahead of time. So it's a lot easier to trim. There's not much of this guy left here. And then the repair is the antifungal topical. That's the oil. Okay, so this is, I think I got a little opening here. There we go. It should come right off. You doing okay?
Yeah.
Good deal. Get the other side here.
So this one's got fungus back in it again, doesn't it?
It does, yeah.
So I had
Look how much.
They took it completely off. But
Did they put any medication or acid on it so it doesn't come back?
I think so. There's the doctor that was here, I think she was from Ohio.
Uh-huh.
She's the one that did it.
Gotcha. Yeah, well, so there's only about a 5% chance that you can get regrowth after using that particular chemical. Yeah. So you think that this pushed on this toe?
I think so.
Okay. You know, I would think there would be something
you
here.
Would think so. That's the only thing I know. What reason it did it? I mean, I can't think anything else.
So it was really. I'm actually going to raise you up. Make it a little better for me. Oh, there we go. So the only thing, it almost looks like a burn of sorts, or it could have rubbed a shoe. So if your toe is bent in there, it could have rubbed the shoe, causing the bleeding. But I was in the introduction, I was saying how you were smart and jumped on to research before you did anything to make sure that you didn't create further issues. Because if you had pierced the skin here with the blister, drained it, that actually breaks the sterile barrier. So that opens up a window for infection.
I see.
And with poor circulation, then that puts you at a high risk. Absolutely. That's the last thing we want. Got some buildup coming up here under the...
Well, I thought about going to Urgent Treatment Center. I said, well, it doesn't hurt. And then I was reading about it. I said, I'm just going to...
Yeah, no, I'm really glad that... Well, I would, for future, go to Urgent Treatment Center. Just in case. Yeah, absolutely. Or call us. I mean, we can get you in right away. going real slow around here because with poor circulation, we don't want to nip ya. Watch my luck, I'll nip ya. Okay. Trying to get this hunk. So now we're down underneath the soft stuff, and so it gets hard again. But look how much is gone already.
I know it.
And it really just isn't even attached. Once that fungus gets in, and especially with the ram's horn type nails, they just layer on themselves. Okay, Katrina, let's move.
So you soak it, what, for like 15, 20 minutes?
15, 20 minutes, exactly.
Every day?
Every day, that's going to help soften it. And that, again, is a prescription strength antifungal. So it can kind of penetrate into the nail plate a little easier. And then you'll get out or, you know, dry them off and then put the topical right on. Look at all this. Look at that, guys. These can come right out. Well, are you ready for Christmas?
Yeah.
Here we go. Yeah, we got into the bleeding just a little bit here. Let's make sure.
When did you move up here?
There we go. Move to to this space.
Yeah.
3 years.
You've been here? I've been here over 3 years.
Yeah, it'll pop around the corner here. Okay, guys, so we're gonna keep a close eye on that spot over here. I got a big hunk of it, but there's a skosh of blood there, so we're gonna put some betadine on it and make sure that it heals properly. But that nail is gone. And what I'll do is cover it before I do the Dremel so there's no nail dust in there as well. If you have any issues, even over Christmas, you call me. The phones get forwarded to us.
Okay.
Yeah, a lot easier. And so you've got a little bit of athlete's foot too, and then between the toes over here. So this is going to be great. The soak is going to take care of that as well.
Okay.
Almost there. So this one was permanently removed, but boy, he just came back.
Yep.
Where do you even start? It's hard to see where the nail is. And once they take over, it almost like, it's like the fungus embeds into the nail bed itself. So it's hard to kind of separate it.
Yeah, she took that whole thing off.
It's really wanting to build up in your corners here of the cuticle. It really likes that spot. I'm not going to be as aggressive over here. I learned my lesson. There's not much. This is going to be better for the Dremel because most of this is attached. So we'll smooth down. Okay. Let me grab some betadine here. Give me 1 second.
Okay.
So betadine or iodine, you have that at home?
I think I got iodine in it.
Yeah, perfect. So you're going to use that just probably for the next 2 days and it'll be healed. Get some fresh gloves. So I'm going to, I want to smooth it. We'll smooth the rough edges down when you come back in a couple weeks just to make sure everything is healed. And then we can really just smooth the rest of it, like I said, down. And we'll do a little follow-up too.
Okay.
Because I just, I don't want any nail dust flying around. There we go. Iodine's been around for, I don't even know how many years. That's a really good question. But it is such good stuff as far as antibacterial. And then we'll get the rest of the nails smoothed down. Do you need to move? Okay. Dremels are great for really thinning out thicker nails. They are super powerful. So you got to be real careful because we have a lot of people try to do this at home and inevitably they'll nick their skin. Okay, let's move over here.
Got another question about neuropathy.
Yeah, go for it.
Do you treat neuropathy if it's up in your legs?
Yes. You mean up in like around the thighs?
No, up in this area.
Oh yeah, absolutely. And that's the laser I was telling you about. That what we do are target the larger nerves, and the goal again is new growth of healthy nerves, and also providing nutritional support to the damaged nerves. A little more power on that one.
Is that a long-term treatment?
That's an excellent question. So generally we start with 9 treatments spaced out over 3 weeks. Then we kind of sit down and talk about improvement, how you are feeling, kind of symptoms, and we kind of track it every visit to see. Some people only need 1 round once a year. Others need it quarterly. It's so patient specific that it's hard to give you an exact, like, okay, you need this many this many visits.
Does insurance pay for that?
If you have HSA, what's the other one? HSA and FSA.
Yep.
FSA, it is absolutely, you can use it for that. But they don't cover, and I mean, it's really such a shame because honestly, we have had, like, every single person that's used it has had improvement, but some are just not 100%. So it's not been, it's never, I guess, not worked. It's just that it depends on how much. This little guy here, this is nice and stable. Let's not touch this guy right here, just like you've been doing. Leave it alone. And what's going to happen is this is going to slough off. And you'll just see it kind of, and don't actively peel it, okay? Just let it come off on its own.
Yeah.
Go. Let's go in between the toes over here. Yeah, I'm excited for you to use that soak and get all this off there.
Yeah.
Okay. We'll get you lotioned up. And we'll let this sit here for just a second to kind of dry. And we'll help you with your socks and shoes too, okay? All right. How's that feel?
Good.
Yeah. The peppermint and the lotion is just, this was my grandpa's signature move. So he would buy these gigantic jugs of peppermint lotion, and I just remember all of his patients, they would come just for that. You know, they loved it. Okay, so you're going to come back and see me in a couple weeks for this, and then we will make sure everything's healed. Again, if there's any concerns, Christmas Day, I do not mind. I'd rather you call me. But I think it's going to be fine. It's just really superficial, like on the surface.
Okay.
Yeah, and then we will Dremel and smooth that down, and you'll be done.
Good. Thank you very much.
You're welcome. Merry Christmas.
Merry Christmas to you.
Thank you. All right, guys. I hope you learned a little bit of something. Most important takeaway here, if you get a blood blister, do not pop it. This is a sterile barrier. Of course, you want to have it followed up with immediately, but that really increases your risk for infection if you pop it, open it up. So this was a big one. This was a big blister.
It was.
Yeah. All right, guys. Don't forget to follow the channel. Comment below. I'll see you next time. Yes, sir. All right. I know what you're thinking. It happens. This is real world. Did you see that big hunk coming out of there? Of course, I couldn't stop and I wanted to get it. Yes, again, it is superficial. He's going to be just fine. I am not worried about it, and I totally jinxed myself, so next time I'm not going to do it. Thanks again for watching the channel. I hope you forgive me. See you next time.